Welcome to part 2 of our discussion with Walgreens on private healthcare exchanges, where we'll talk more about the communication aspect of this program. So when we talk about rollout, was there a specific timeline in place for the rollout of the program?
Yes, there was, and it was extremely condensed, Allison. We basically in June of last year made the decision with our leaders to move forward, and we rolled out with open enrollment in October. The first meeting I went to, I was astounded. There were almost 50 people in the room who were really putting their shoulders to the wheel and really wanted to make this happen and wanted to make it happen with operational excellence.
So who were some of the key stakeholders internally to get on board and be part of the communication plan for implementation?
Yeah, we built a strategy around 4 different tiers of communication pathways or stakeholders. The leadership, naturally, we get their buy-in and their thought process to the large communication program. The next layer of management, the people who are close to the leadership, but in that next layer, then the HR community and the store managers, because they're so key, and then the employees. And as we built that communication program all the way up to the announcement, again, we had to be sensitive about how this was announced to both our team members and to the public because of the visibility of our choice, being a leading large employer to come into this space. So the announcement sequence was very key. We did fall down a little bit. We had some communication conundrums in the beginning, but I think it's because it's such a large workforce that's so diversified across the country that it makes it very difficult to quickly maneuver through a public communication and then a communication down to team members that makes sense. It's a lesson we learned, but I think we were effective in getting around it because we had built the structure prior to that for those 4 tiers. We leveraged the HR community, we leveraged the store managers and the leadership of the stores and the distribution centers, and we got them to buy in. And I think because when we said earlier in round 1 that the leadership was so key, I think the leadership driving this through their own leadership and through their teams helped to calm the noise. And then we leveraged every technology solution we could, blogs, webinars, postings, Facebook presence, to communicate and answer questions as we worked up to open enrollment.
How did the communication with external providers come into this?
Yeah, so it was a complex communication platform because we were moving away from the traditional model. So we had to communicate to previous partners and to shareholders and to investors and to the press. And we leveraged our PR department. We were joined at the hip with our PR public relations leadership. We also had to communicate to the government. It turned out that the government had a stake in what we were doing, and it came out at a time that was a little contentious for the government with the public exchange issues they were having. So we were dealing with a whole host of public entities in communicating this to them as well. And I think I talked to more investors and shareholders than I have in my career. But it was important that they understand why we made this move.
We talked in part 1 about getting senior management on board. How about for employees? Was there a lot of pushback or extra communication to correct any misperceptions about the programs that were needed?
During the hot period of enrollment, it was really key that we had to stay on top of the messages that were out there in the blogosphere and in Facebook and in the public. And our public relations and communication department at the corporate level helped us do that. They leveraged those tools, they monitored those tools. We have a great crawling service that looks for anything that's happening with Walgreens out in the space. And they brought those to us and we addressed them really quickly. So I think that is calmed down quite a bit. I think people have embraced this. The feedback we've received on surveys has just been overwhelming about people and appreciating the choice and the ability to understand what we pay versus what they pay. Those were very appreciative, and I think that continues. I think the new hire process now shifts the focus, and we leverage through recruiting and through some orientation materials that we have to help the new hire.
So now we're into open enrollment. Does that process look different than it has in years past?
I mean, like Mark said, I think our tools and resources were much more advanced. There's a new website for people to go to. They had to register for the first time. Some of our stores had some difficulty accessing the website, and we had to get around that. But I think overall the experience was much improved. The flow of the website, the tools and resources available to the team member to make choice, or for their family members to make choice, gave access to them at a much greater level. and drove some of that decision making through the process. And I think that we advanced our flexible spending account. For the first time, we were able to issue a credit card. Huge win for our people. In the past, it had been all paper. So a lot of advances in technology that made what is traditionally normal in this space look amazing to our people, I think.
I will say that the buying experience hasn't really taken for many of us yet. And here's what I mean by that. In the prior environment, you had two plans, and you were already signed up for one, and there may not have been anything for you to do, except see what your new payroll contribution was going to be. There was not a lot of active brain power necessarily associated with your enrollment choice year after year. In this particular case, there's a lot of choice. There's potentially up to 5 health plans, up to 4 dental plans, and up to 3 vision plans. So if you kind of went into it with a check the box, hit a radio button kind of mentality, you may have ended up buying something a little different than you thought you were going to get. So we've realized after the fact that that did happen anecdotally with some of us, including some of us on our own team. And we need to do a better job in succeeding years of really helping people understand what a true buying experience needs to be. They need to take some time with these tools, and they really need to understand what they're purchasing. Really look at, whether your provider's in the network, really look at, what goes with a Bronze Plus plan. You might be attracted to the lower premium of a Bronze Plus, but know that it doesn't cover everything that, a Gold plan might offer.
You both have mentioned some of the hurdles along the way, and I'm curious, from a communications perspective, is there a single greatest learning here for others who might be attempting this?
Yeah, you cannot over-communicate. I think we used a strategy that not only drove through stakeholders, but also communicated a number of times to people in a number of different ways. At least 3 times somebody saw something in a different manner that advertised what we were doing. But I think you cannot do that enough.
My response to that question would be, do not underestimate the value of getting leadership buy-in. And it's not just, it doesn't happen in a single meeting.
Well, in our final part in this series on private healthcare exchanges, we'll talk a little bit more about measuring the success and where you go from here. Thank you.